Ibuprofen Ib Tablet, chewable, is used to relieve pain from various conditions such as headache, dental pain, menstrual cramps, muscle aches, or arthritis. It is also used to reduce fever and to relieve minor aches and pain due to the common cold or flu. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. This form of ibuprofen is intended for use by children. Do not give this medication to a child younger than 2 years unless directed by the doctor. It's important to check the ingredients on the label even if you have used the product before, as the manufacturer may have changed the ingredients. Also, products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. The daily dosage and optimal timing for taking Ibuprofen Ib Tablet, chewable, should be consulted with your healthcare provider. Make sure to read and follow all the instructions on the product package before using this medication. If you have any questions, be sure to ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor or the package label, usually every 6 to 8 hours as needed. Chew thoroughly and then swallow this medication. If you experience stomach upset while taking this medication, take it with food, milk, or an antacid. The dosage is based on your medical condition and response to treatment. To reduce your risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or take this drug more often than directed by your doctor or the package label. When ibuprofen is used by children, the dose is based on the child's weight. Read the package directions to find the proper dose for your child's weight. Consult the pharmacist or doctor if you have questions or if you need help choosing a non-prescription product. If you are using this drug as needed, not on a regular schedule, remember that pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. If you are using the non-prescription product to treat yourself or a child for fever or pain, consult the doctor right away if fever gets worse or lasts more than 3 days, or if pain gets worse or lasts more than 10 days. Possible side effects of Ibuprofen Ib Tablet, chewable, may include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. If your doctor has prescribed this medication for you, they have determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. It's important to monitor your blood pressure regularly while taking this medication and inform your doctor if the results are high. Contact your doctor immediately if you experience serious side effects such as easy bruising/bleeding, changes in hearing, mental/mood changes, unexplained stiff neck, signs of kidney problems, vision changes, or symptoms of heart failure. Rarely, this medication may cause serious liver damage. Seek medical help if you notice symptoms such as nausea/vomiting, loss of appetite, dark urine, stomach/abdominal pain, or yellowing of the eyes/skin. Although a serious allergic reaction to this drug is rare, seek immediate medical assistance if you experience symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of potential side effects. If you notice any other effects, contact your doctor or pharmacist. If you are in the US, call your doctor for medical advice about side effects. You may also report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects and report them to Health Canada at 1-866-234-2345. Taking ibuprofen tablets can rarely increase the risk of a heart attack or stroke, especially if you take it for a long time. This risk may be higher for older adults or those with heart disease, high blood pressure, or diabetes. It's important not to take this medication right before or after heart bypass surgery. There is also a rare risk of serious bleeding from the stomach or intestines, especially for older adults. If you experience persistent stomach pain, black or tarry stools, or vomiting that looks like coffee grounds, seek medical help immediately. Other serious side effects may include chest pain, shortness of breath, sudden weakness, or changes in vision. Talk to your doctor or pharmacist about the benefits and risks of taking ibuprofen tablets, and be sure to follow the recommended dosage and timing for optimal results. Before taking Ibuprofen Ib Tablet, Chewable, it's important to discuss any allergies with your doctor or pharmacist. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's essential to talk to your pharmacist for more details. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, kidney problems, or if you're an older adult. This medication can sometimes cause kidney problems, especially if you're dehydrated or have certain medical conditions. Ibuprofen Ib Tablet, Chewable may cause dizziness or drowsiness, and using alcohol or marijuana can further increase these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. Limiting alcohol and stopping smoking can also reduce the risk of stomach bleeding while using this medication. Additionally, this medication may make you more sensitive to the sun, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid sugar and aspartame, it's important to use this product with caution and consult your doctor or pharmacist about using it safely. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. For women of childbearing age, it's important to discuss the benefits and risks of using this medication with your doctor. If you are pregnant or planning to become pregnant, it's essential to inform your doctor as this medication may harm an unborn baby and cause problems with normal labor and delivery. If your doctor determines that you need to use this medication during pregnancy, it should be at the lowest effective dose for the shortest possible time. It's not recommended for use after 30 weeks of pregnancy. This medication passes into breast milk, but is unlikely to harm a nursing infant. It's important to consult your doctor before breastfeeding while using Ibuprofen Ib Tablet, Chewable. It's important to be aware of potential drug interactions when taking Ibuprofen Ib Tablet, Chewable. Some medications, like aliskiren, ACE inhibitors, angiotensin II receptor blockers, corticosteroids, and lithium, may interact with this drug, increasing the risk of serious side effects. This medication may also increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. It's crucial to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to ibuprofen and may increase the risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, it's important to continue taking the aspirin unless instructed otherwise. However, daily use of ibuprofen may decrease aspirin's ability to prevent heart attack/stroke, so it's important to talk to your doctor about using a different medication to treat pain/fever. If you must take ibuprofen, talk to your doctor about taking immediate-release aspirin while taking ibuprofen, and make sure to take ibuprofen at least 8 hours before or at least 2 hours after your aspirin dose. It's important not to increase your daily dose of aspirin or change the way you take aspirin/other medications without your doctor's approval. If someone has taken too much Ibuprofen Ib Tablet, Chewable, and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. For Canadian residents, contact your provincial poison control center. Symptoms of an ibuprofen overdose may include severe stomach pain, difficulty breathing, and extreme drowsiness. During your treatment with Ibuprofen Ib Tablet, Chewable, you may need to undergo lab tests and medical checkups to monitor your blood pressure and kidney function. It is important to attend all your scheduled appointments and consult your doctor for further information. If you are taking this medication regularly and you forget a dose, take it as soon as you remember. If it's close to the time for your next dose, skip the missed one and take the next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to store Ibuprofen Ib Tablet, chewable at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. When it's expired or no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance. And remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.